The Ebola outbreak could have its first Canadian connection. A hospital in Brampton, Ontario is treating a patient who recently came back from Nigeria. The hospital says the person has a fever and other Ebola-like symptoms and is now in isolation while testing is done. And the World Health Organization today declared Ebola an international public health emergency. As Crystal Gamansing reports, there are calls for Canada to step up and send medical staff to Africa immediately.
There have been outbreaks in the past, but nothing like what's happening in West Africa right now. The outbreak isn't slowing down.
The Canadian government needs to redouble its contribution.
Jonathan Jennings says Canada has been supportive, but now the government needs to send doctors, epidemiologists, and infectious disease specialists to the outbreak zones. Doctors Without Borders is the main medical group helping the sick and dying, and the agency is tapped.
To date, there's been no oversight. There's been no leadership atop looking down on the region and decision-taking and strategizing in order to ensure that the outbreak is controlled, and that's desperately needed.
Nearly 1,000 people have died from the virus. Ebola is spread through contact with bodily fluids such as blood. It ignites the body's immune system, sending it into overdrive. Organs can shut down and hemorrhage.
Countries affected to date simply do not have the capacity to manage an outbreak of this size and complexity on their own.
Non-essential travel to the outbreak zone is not recommended. It's possible there could be Ebola cases discovered here in Canada. Earlier this week, staff at emergency rooms at a number of Toronto hospitals were reminded of the importance of taking travel history from sick patients. Doctors say the key will be identifying these patients quickly and getting them into isolation. Meanwhile, at a major airport in Sierra Leone, passengers are being screened for the virus. One of the first symptoms of Ebola is fever. But infectious disease experts warn this won't stop the spread of the deadly virus. The focus needs to be on prevention and treatment efforts at the source in West Africa. Crystal Gamansing, Global News, Toronto.